Welcome to this video entitled Using the Tone Pacer Pro. In this video we're going to discuss how to use the Tone Pacer Pro application for various aspects of neuro rehabilitation. This is a how-to video to show you the features of the Tone Pacer Pro app and how to use them for your patients in rehabilitation. This is the Tone Pacer Pro graphical user interface. Now it varies slightly between which version you're using, if you're using the application designed for iPhone or if you're using it on a tablet, but the basic functions are all similar. Here you see at the asterisk is the timer function. To activate the timer, you slide the timer button to the right and the timer indicator will turn green. Now to set the time you want, it's a countdown timer. You can either tap the minutes box or the seconds box. Tapping the box will pop the numerical keypad as seen on the illustration on the right. Enter the value you want in either minutes or seconds and select Done. If you're using the iPad, you'll select the button that closes the keypad. So to activate the timer function, slide the button till it turns green, tap on the either minutes or second field, enter your time required. Typically for many of the applications we use 90 seconds. Hit the Done button and you're ready to go. To start the application, hit the play button on the pause play button at the very top of the application. Here you see the number 90 entered in the seconds field by the asterisk, the red asterisk. And you tap the Done button, which should close your keypad. And this sets your timer. If you want to disable the timer, just slide the button from right to left so it's unenabled, as seen on the left picture here on our slide. The Tone Pacer Pro has a unique feature unavailable on the Tone Pacer original application. The Tone Pacer Pro allows you to set a custom frequency. This slide shows you how to do that. You see the label for custom frequency on the picture on the left hand side of the slide here. You see the red asterisk. And much like setting the parameters on the timer, you select the tone that you want to change to a custom frequency by tapping it. If you look at the illustration on the right side of the slide here, we're going to tap the first field for tone, which we'll call tone 1, to select it. Then you'll tap in the blank field next to the custom frequency label. If you want to change the custom frequency of tone 2, you tap and select on the second tone field and tap on the custom frequency label field, which will pop the numeric keypad. Very similar to how you change the timer settings. So by convention we call the leftmost field for the tone, tone 1, and the one just to the right of that, tone 2. So in this example we're going to select the field for tone 1, tap on it to highlight it, and tap on the custom frequency field where the asterisk is seen on the slide here on the right. This pops the numeric keyboard, and in this instance we're showing the appearance that you'll see on the iPad as opposed to the iPhone. Rather than tapping the Done button like you do on the iPhone, tap on the close keyboard key seen with the asterisk down in the right lower side of the slide here. In this illustration we're entering a custom tone, and tone 1 is 2500 Hz. Now to change tone 2, you just repeat the process and select the right-sided tone indicator as opposed to the left-sided tone indicator seen here with the red arrow as opposed to the blue arrow, and repeat the process. Okay, so let's look at some other options and settings we can use with the Tone Pacer Pro. The asterisk in the top field to the right of the slide here is the fixed interval setting. In virtually every application we use the fixed interval setting as opposed to a random interval. Be careful when you're setting up your applications. Sometimes you accidentally hit the random interval setting, which disables the beeps per minute function. So remember to check to make sure your setting is on fixed interval. Then right below the asterisk with the fixed interval or your selection, you have tone 1, tone 2, combined, and alternative or alternating. See the second asterisk. Alternating allows the app to play tone 1 and tone 2 in alternating fashion. So in our application setup here we have 2500 and 500. This will alternate tones between the tone 1 and tone 2. Going to the middle image in the right hand side of the slide, you see our beeps per minute controls. For most settings you will have the constant function, the switch to the left or in the disabled position. Just like the slider for the timer setting, if you slide this from left to right, it will turn green and the tones will no longer be subject to the input from the beeps per minute slider. It will remain on constantly. On the third image, on the bottom image to the right here, this is your headphone setup. You can see that both ears are highlighted. So that bar from left to right, if you highlight the first box there, first speaker, it will play just in the left ear. So based on the parameters we have set up here, fixed interval, alternating 20 beeps per minute, every 3 seconds, the app will alternate between the tone 1 and tone 2 settings. As we have it set up here, the both ear indicator is highlighted. So this would play alternating 500, 2500 tones in both ears. If we follow across the image on the bottom of the right hand side of the screen, there's a setting for right ear only, a question mark which is random, and then one with arrows pointing left and right. That's alternating left and right ear. We're going to describe an application coming up here, a clinical Pearl, that uses these parameters as seen on this slide, with 2500 versus 500 alternating both ears, and every 3 seconds the tone will be played. In the following groups of slides, or series of slides, we're going to describe some clinical pearls and tell you the setup for the Tone Pacer app for the application. The science and hardcore neurology behind the clinical applications will be described and published on our website under Clinical Pearls. This is just to show you the application settings for the various clinical pearls that we will be publishing shortly. With this setup, we have the graphical user interface of the app shown on the right, and this is for convergence insufficiency rehabilitation. You can see the timer's green, it's set for 90 seconds, it's set for fixed intervals, it's set for alternating, the beeps per minute are set at 20, which is about every 3 seconds. The custom fields are set at 2500 versus 500 Hertz, and the headphones are set for both ears. When you run this app, the settings are such that the patient will hear 2500 Hertz tone in both ears, and then 3 seconds later they will hear the 500 Hertz tone. And there's research to suggest that a 500 Hertz tone assists in the convergence of the eyes. So what you're going to do is have your patient look at a far target. 2500 Hertz tone will be a much higher frequency, much higher pitch, and while the patient hears the high pitch, the 2500 Hertz tone, they're to look at a distant target and fixate on that target for the 3-second interval. When the tone shifts to the 500 Hertz tone, the lower tone, they are to converge on a near point target. We do this for about 90 seconds, which is about as much as most patients can handle before they fatigue. But this assists with the rehabilitation of convergence. And as I say, we'll have the complete protocol and the science behind it available on our website as a clinical pearl. Okay, we're going to describe the settings for EMDR OPK stimulation. This is a clinical application for anxiety and hyperactivity in the sympathetic nervous system. It's based on eye movement, deprogramming, and desensitization. What you do is you have the patient close their eyes and move their eyes left and right based on the sound. So the settings in the app are going to alternate or reciprocate between left and right ear. And we'll tell you what the settings are and what their purpose is. Again, the science and the hardcore neurology will be available on a Clinical Pearl video on our website. So let's look at the graphical user interface. The top button starts and stops or pauses the app. We have the timer set, it's in green, 90 seconds, fixed intervals. This time we're using the combined mode. What this is going to do is going to combine tone 1 and tone 2. Tone 1 and tone 2 are set up at 100 and 500 Hertz respectively. These are in the range that activates the vestibular system, which has been shown to calm anxiety. They're going to be combined, however, and in this case, or in our combined setting, tone 2 will be delivered at one ear, say the left ear, and tone 1 will be delivered in the opposite ear. We have our beeps per minute at 15, which is 4-second intervals, which may be too slow or too fast depending on your patient's ability to follow the tone, and the headphone selector is reciprocating. So in this application, what's going to happen is there's going to be a tone played with one 500 Hz on one side, one 100 Hz on the other side, and we instruct the patient to follow the higher tone, the 500 Hz tone, with their eyes. So let's say they hear the 500 Hz tone in their left ear. They're going to follow that tone with their eyes. So when they hear the 500 Hz tone in their left ear, they're going to move their eyes to the left and hold it there till the next tone. In 4 seconds or less, depending on how you set up the beeps per minute, they'll hear the reciprocal, where they'll hear the 500 Hz tone in the opposite ear. They are instructed to follow that tone with their eyes, keeping their eyes closed. So there's going to be following of the tone left and right with the eyes. We do this in 90-second blocks to avoid metabolic fatigue. I'm not shown in it as a separate application, but it will be included in our clinical Pearl video on this technique, is using optokinetic downward stimulation with suppression to activate the anterior cingulate cortex, which also has a soothing or anti-panic effect on the patient. So you can look for the video that explains the science behind that and also the exact techniques. Again, this short video segment is just to show you the setup and how the different settings on the Tone Pacer Pro app work. So let's take a closer look at the combined setting. It has some unique features and is important to a lot of clinical applications. The app is hardwired that tone 2 will be played in the selected ear in the combined mode. So in our illustration here, tone 2 happens to be 500 Hz. So if I select number 1, the left ear, that means due to the hardwiring of the program, the tone 2, or in this case 500 Hz, will be played in the left ear. Because it's a combined setting, that means that the opposite ear, the right ear, will receive input from tone 1, which in this case is 100 Hz. Now keep in mind, if you change the custom frequency settings, that tone 1 and tone 2 may not be 100 and 500 Hz respectively. Keep in mind that whatever tone 2 is in your selection, that is linked to the ear selector. So one more time. Tone 2, whatever it is, in this case it's 500 Hz, will be played in the ear that you select with the ear selectors at the bottom of the app. Tone 1 will be played in the other ear. So this means if you select 1, left ear, 500 Hz will be played in the left ear, 100 Hz will be played in the right ear. If you select 2, both 500 and 100 Hz will be played in both ears. If you select 3, 100 Hz will be played in the left ear, 500 Hz will be played in the right ear. If you select 4, the question mark, that means random, so the tone 1 and tone 2 will randomly change between ears. And number 5 is reciprocating, which means that it will reciprocate from 500 left ear to 500 right ear, with the opposite tone being played in the opposite ear. That's important for gait training. Again, remember, with the custom app, or with the Tone Pacer Pro, you can set the tone 1 and tone 2 to custom frequencies. So make sure if you want the application set up 100, 500, that you set your custom frequencies to those ranges. This becomes very important when we do canal rehabilitation, the push-pull anterior canal on one side, linked with the posterior canal on the opposite side. You want the 500, 100 Hz. This is described in detail in our first video on Tone Pacer, available for free on our website. This clinical Pearl describes the setup for binaural beats with the Tone Pacer Pro. One of the advantages of the Tone Pacer Pro is you can create binaural beats, which is not an available feature on the standard version of Tone Pacer. Again, the science behind the application will be featured on one of our clinical Pearl videos on our website. But to suffice it to say that a binaural beat is a phantom beat that's created in the brain when you play 2 separate pure tones, one in the left ear and one in the right ear, that are similar but not identical frequencies. So if you look at our slide here, we play a 250 Hz tone in the right ear and a 275 Hz tone in the left ear. What will happen is the brain will take the difference between the 250 and 275 and create a third tone at 25 Hz. which is your binaural beat. This can be used for brain entrainment because the brain will start to follow this binaural beat frequency, and so you can do different brain oscillations, alpha, beta, gamma, and delta, depending on the application you want to use for your patient. And again, this will be described in detail with the science and literature that support it in our video clinical pearl. But let's look at the application setup and how you create binaural beeps with the Tone Pacer Pro. For this application, we want the timer off because you're going to apply this. It takes about 10 to 20 minutes for the brain to entrain to the phantom beat that you're creating. You want fixed interval. You want the combined setting because you want to play tone 1 in one ear and tone 2 in the other ear. In this example, we're playing 275 in the right ear and 275 in the left ear, 250 in the right ear. We're going to turn our constant switch on. See the green marker here, which is going to disable the beeps per minute and play the tones constantly. Now this is very important. You do not want to play the tones in both ears because they would cancel each other out. You want 250 in one ear and 275 in the other to create your binaural beat. As we discussed in the previous slide, when you use a combined setting, tone 2 is going to be played in the ear you select. So in this setup, we have the left ear highlighted or selected. So tone 2 is going to be played in the left ear. Tone 1, because of the combined mode and the hardwiring of the program, will be played in the opposite ear. This gives you your gradient or differential between left and right ear, which the brain creates the binaural beat with. So let me say that again. You do not want to play both tones in both ears. They'll cancel each other out. I'm going to use a combined setting and play one tone in one ear, the other tone in the other. It doesn't matter which ear receives which tone, just as long as they don't receive both tones, because the brain itself is creating the binaural beat. There's a lot of applications for this. It involves brain entrainment, and we'll discuss those on the clinical pearl application video concerning binaural beeps. Okay, this is the application setup for using the Tone Pacer to stimulate central pattern generators for gait rehabilitation. And once again, the science behind all this is available or will be available on our clinical pearl videos on our website. Let's discuss the setup here. We're going to have the timer off, fixed interval. We're going to set the selector on combined. We're going to custom set our frequencies, if they're not already on it, to 100 and 500. We're going to turn the constant button off. We're going to set the beeps per minute depending on our application. I often use a reciprocating TENS unit to stimulate the peripheral nerves left and right. And my setup on my equipment is either every 3-second interval or every 1-second interval. The basic science behind it suggests that 1-second intervals are more appropriate to activate central pattern generators. So in this application, we're going to set the beeps per minute to 60, which is 1-second intervals. And we're going to set the headphone setting on reciprocating. So with the combined modes selected and the reciprocating mode selected, the 501 Hz, 500 Hz on one ear and 100 Hz on the other ear are going to reciprocate back and forth between left and right. Again, we usually tie this into reciprocating electrical stimulation left and right. You can also do it on a stationary bike. If you do it on a stationary bike, you can set or a treadmill for that matter, you can set the beeps per minute to coincide with the normal gait rhythm for your patient. This application we call tone-assisted range of motion. We found it to be very effective for frozen shoulder, stroke rehabilitation, and rehabilitation of patients with MS that have spasticity or contractions. The setup on the app is you're going to want to do this in 90-second intervals. They're going to be fixed intervals. We're going to use the combined 500, 100 Hz frequencies. We're going to set the beeps per minute to around 38 to 43. This is because you're going to physically assist the patient through restricted range of motion in synchronization with the beeps. It may be a little faster or a little slower depending on the body part you're moving and how the patient tolerates and how fast you are with your basically tone-assisted stretching at the end range of motion. We play this in both ears on combined, so they're going to get 500 in both ears and 100 in both ears. Again, we do it in 90-second blocks, which is about all the patient can tolerate. Look for the detailed version of this application on our website under Clinical Pearls. This application deals with pain control using the tone pacer, and it's a very rewarding set of techniques. There's a little trial and error with this one. As far as frequencies, we typically use combined 100, 500, but we have found that some patients respond better to a higher frequency, for some reason, notably 2000 to 2500 hertz. So try it with your patients, see which frequency they respond the best to, and use that frequency for that individual patient. Now, SITS refers to sound integrated tactile stimulation. We have a lot of videos on our YouTube channel that show this application. SITS is visual integrated tactile stimulation. And something that's real interesting is if you use a pulse oximeter, if the patient has a steady and stable heart rate, you can set the beeps per minute to their heart rate, and that ties into the interoceptive portion of the nervous system, which is good for chronic pain control. So let's look at our setup here. Again, timer on 90 seconds, fixed frequency combined in this application, 100, 500. We're playing it into both ears, so they're getting vestibular stimulation on the right and the left ear. And this is an interoceptive setup here where we determine the pulse rate of the patient to be pretty consistent at 72. So we set the beeps per minute at 72 and apply our application. As all of these setups are just to show you how to set the controls up on the app. The real meat and potatoes and clinical applications will appear as a clinical pearl on our website. Okay, this application shows you how to do canal, semicircular canal pair rehabilitation. Quick refresher, the left posterior canal and the right anterior canal are linked in a push-pulled fashion. Likewise, the right posterior canal and the left anterior canal work in a push-pull fashion. If you refer to our first video on tone pacer, it goes in great detail about 500 hertz being related to the posterior canal and 100 hertz being related to the anterior canal. So let's say in a patient we've discovered through clinical examination that their right posterior canal and left anterior canal pair is deficient or dysfunctioning. Our setup would be such that we set up the combined mode, 90-second intervals, fixed interval. The combined mode, remember, is going to put tone 2, which happens to be the 500 hertz tone, in the ear we select. Now, given our example here, we said the posterior canal on the right side is dysfunctional. As such, its paired left anterior canal is going to be dysfunctional. So we want to set up our tone pacer with the 500 hertz tone in the right ear to stimulate the posterior canal on the right, and the 100 hertz tone on the left ear to stimulate the anterior paired canal on the left. We do that by selecting the combined frequency, which, as we stated previously, places tone 2, which happens to be the 500 hertz tone in this example, in the right ear, and also places the 100 hertz tone in the opposite ear, in this case the left ear. So we're going to get a rehabilitation of the canal pair right posterior, left anterior, which we determined by clinical examination was a dysfunctioning canal pair. For canal rehabilitation, we set the beeps per minute, usually it's 78 to start, and we either increase the beeps per minute or decrease the beeps per minute while observing the patient's response to the intervention on a balance platform. So the bright idea is to remember that on combined, tone 2 is going to be placed in the ear that you want to select or that you have selected on the headphone selector. That will be placed on the side of the deficient posterior canal. And by convention and by hardwiring, the 100 hertz tone, which works the anterior canal, will be placed in the opposite ear. So you select your ear according to the dysfunction in the posterior canal. This application is based on the research concerning stochastic vestibular stimulation. Stochastic is just a fancy word for random, and they've done this with galvanic stimulation in patients with Parkinson's disease. We've kind of modified it with vestibular stimulation based on tone bursts. We found it to be effective in tremor suppression. So let's see how this works. We're going to have the 100, 500 hertz tones. We're going to put it on combined. We're going to turn the timer off because this technique requires at the minimum of 10 minutes stimulation. The longer the better. Now, because it's a random generation of vestibular stimulation, be careful that the patient doesn't get seasick or otherwise is intolerant of this type of random vestibular stimulation. Here we set the beeps per minute to 100, so it's a very fast beeps per minute application. People have asked me why I prefer the wired bone-conducting headphones versus the Bluetooth version. I found with this fast application that the Bluetooth type of headsets tend to degrade in quality, where the wired version of the headphones maintains stability over fast and long output. This is where we're going to use the random feature, the question mark on the earphones. So what's going to happen in this application is you're going to have 100 and 500 hertz being played in random order through left and right ear or both ears. This is going to create stochastic or random stimulation of the vestibular system, which research has shown may influence movement in both Parkinson's disease and maybe suppress tremor. And it's like all our other applications, we'll have the science that supports the concept on our website under Clinical Pearls. This just illustrates the use of the random feature in a technique called stochastic vestibular stimulation.